Young people, are you ready to get real about your health? Join us at 7 p.m. every Wednesday for Chat4Health on Women Radio as we bring you straight talk on the things that matter. No lectures, no judgments, just real and honest conversations about your sexual and reproductive health to help you make choices that keep you safe and empowered. From preventing unwanted pregnancies to protecting yourself from HIV and STIs and overcoming stigma, Chat4Health has got you covered. Chat4Health, where your questions meet the answers you deserve. Chat4Health, 7 p.m. every Wednesday on Women Radio 91.7. It's brought to you by Age Network in partnership with PEPFAR Nigeria, Gilead Science, and AWDF. All right, 3 minutes past 7 from Women Radio 91.7. How are you doing today? I really do hope that your day has been a lovely one for you. And I also hope that you're doing all that you can to stay healthy. You know what I say now, health is wealth. Today is Wednesday, day 27 in the month of November 2024. And I know that whenever you hear my voice at this time of the day, it is time for Chat4Health. So, Chat4Health is that program where we get to talk about everything you need to know about your sexual and reproductive health because we're here to ensure that you stay safe and empowered. This is exactly why we are doing this on the show. Chat4Health is proudly sponsored by Age Network in partnership with PEPFAR Nigeria, Gilead Science, and AWDF. My name is Blessing Aweta, and of course, I'll be your host for today. Today is definitely going to be a whole lot for you or for us as we get to learn so much on the show. If you would recall, last week on the show we discussed the topic Understanding PrEP and PEP, preventive tools everyone should know. But we had a lot of network issues last week, so we could not even exhaust the conversation. And of course, we had so much to talk about. So today, we will continue in that light because, you know, we're here to ensure that you understand HIV preventive tools better. So joining me on the show today, I have Dr. Tariro Dorothy Togarepi, a compassionate and committed medical professional with a couple of years of experience in the health field. And yes, she currently serves as a senior resident medical officer at Sally Mugabe Central Hospital in Harare, Zimbabwe. Hi, Dr. Tariro. How are you doing today?
Good evening, Blessing. All right, thanks. How are you? How is that side of the country?
Very well, thank you. It's so good to have you on the show today.
Thank you for hosting me tonight. It's an honor to be here.
All right. I would like us to delve into the conversation already. Now, what would you describe as PrEP and what would you describe as PEP and how do they work?
Okay, so when we talk about PrEP, that is pre-exposure prophylaxis. And then when we say PEP, we are talking about post-exposure prophylaxis. So these are basically medicines that we use in preventing an HIV infection. So PrEP is pre-exposure, which means it's before the event that puts you at risk of getting the transmission of HIV. And then if it is post-exposure, we are saying this is the medicine you use after the incident that could have potentially given you the HIV virus. So this medication helps you, like, if it is pre-exposure, like before the incident, for example, people that are at high risk of getting HIV, maybe from a relationship with a partner who is HIV positive.
Okay.
If they take this medication before the encounter, then it prevents the infection from actually sticking and causing them to be infected. And then after the exposure, it can be just after someone has had an unfortunate incident, for example, an assault, and they probably don't even know if the person is HIV positive or not, then they can use this medication to prevent getting infected after they have had the incident already.
All right, thank you very much for that explanation. I mean, from what you just said, it is obvious that there is a clear difference between PrEP and PEP, pre-exposure and post-exposure. And now, talking about PrEP and PEP, how effective are they when it comes to preventing HIV transmission?
The pre-exposure prophylaxis, PEP, it actually reduces the risk of getting HIV. Well, it's in two parts. If it is from sexual intercourse, it's about 99%, which is very high. And then if it is from injections, for example, me as a professional health worker, I can get injected accidentally, or from people who use drugs, they can share needles and get injected. It's a little bit lower, it's 74%, but it is still good. And then for post-exposure prophylaxis, research hasn't been able to really say the exact percentage with which it reduces, but they have said it is more than 80%, which is also good. So we can safely conclude that these are effective methods of preventing HIV.
All right, thank you very, very much for your thoughts on the show for tonight. Now, let's talk about this. Can PEP protect against other sexually transmitted infections? Or are we just talking about it being effective just against HIV?
Oh, okay. So for PEP, the post-exposure prophylaxis in itself has got tools. So when you look at post-exposure prophylaxis, we have tools against HIV, which is the antiretroviral medication. But we also have tools against hepatitis B infection, which is an injection which you can give separately. And we also have tools for STIs, which are antibiotics that can also be administered to a person. And when we're talking about these tools, we also include emergency contraceptives. So these are all part of post-exposure prophylaxis. So they're just various tools that are there. So it can be included, the STIs, but it's not the same drug that does it. You will have to have other antibiotics aided as part of the post-exposure prophylaxis against the STIs. So against HIV, it's one drug and then different drugs for the HIV, for the STIs, for the hepatitis Bs, or even for pregnancy.
All right, thank you very much for your thoughts on that one, Dr. Tariro. It has been very enlightening talking about PrEP and PEP, pre-exposure prophylaxis and post-exposure prophylaxis. Thank you for making us to understand how effective they are, and of course, thank you for making us to understand the importance of having these tools, these HIV preventive tools, handy, particularly when it comes to people who have been exposed or who are likely to be exposed. My name is Blessing Abate, and if you're just joining us, you're listening to Chat4Health on Women Radio WFM 91.7. Chat4Health is that program where we talk about everything you need to know as regards your sexual and reproductive health, and we do this to ensure that you stay safe and empowered.
Country people, Belle by Choice movements don't come again with our annual Belle by Choice campaign tagged 10,000 men give Belle by Choice, not by force challenge. We won't reach 10,000 men and young boys them in various communities with the right information on how they fit support women and girls' sexual and reproductive health, and they inform on modern contraception and family planning matter to end unwanted pregnancies. We won't make our papa, husbands, uncles and brothers know say women and adolescent girls get right to their body and make them join hands to end rape, child marriage, sexual violence, and kasala wey they cause, such as girls' school dropout and unsafe abortion where they threaten women's lives. If men they involved and supporting sexual and reproductive health and rights matter, it could empower women and adolescent girls to make informed choices about their health and could make them carry Belle by Choice. The 10,000 men give Belle by Choice could start 1st of September to 30th December 2024 in Nigeria. If you be man, woman, young girl or boy, join Join our movement to build a future where choices are made. For more information and inquiries about the campaign program, contact Martina Ebre on 0704 806 5486. Together, let us build a safe environment for women and adolescent girls. Remember, Belle now by choice, not by force. Belle by Choice movement is brought to you by AGE and other young women groups them with support from the African Women Development Fund.
All right, 12 minutes past 7 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. If you are just joining us, you're listening to Chat4Health. Chat4Health is that program where we get to talk about everything that has to do with your sexual and reproductive health. And today on the show, I have Dr. Tariro Dorothy Togarepi, who has been taking us through the things we need to know about PrEP and PEP, preventive tools everyone should know. Now, Dr. Togarepi has been able to describe what it means when you hear the word PrEP, pre-exposure prophylaxis, and the post-exposure prophylaxis. She has been able to establish the difference between the two tools, and then, of course, she has told us how effective they are when it comes to preventing HIV transmission. All right, Dr. Dorothy, I would like us to, I've called you different names on the show. I've called you Dr. Tariro. I've called you Dr. Dorothy. Just take me like that. Take me like that. All right. So, Dr. Tariro, let's talk about this one. Let's talk about the misconceptions for a moment. Is it true that using PrEP encourages risky sexual behavior? Because, if you look at it, some people will say that as long as there's something I can use to protect myself, then I can start frolicking around. How do we address such a misconception?
Thank you very much for that question. This misconception is unfortunately true. We do find people that say that, but it is due to lack of knowledge. The reason being, using PrEP alone is effective, yes, but the effectiveness is actually increased by using other safe sex practices. Okay. For example, using condoms, having one faithful partner, and getting tested regularly, as well as checking on their HIV statuses, as well as being checked for STIs. So the misconception is really there because it is rooted in the idea that people who use PrEP are more likely to engage in sexual activities. But the truth is that people who use PrEP are just as likely to engage in safe sex practices as other people who do not use PrEP. And people who are promiscuous will most probably continue being promiscuous, whether or not PrEP is there. But here with PrEP, we are saying, despite someone's behavior, you can actually take hold of your health. And with PrEP, someone can actually become more conscious about their sexual health and actually take steps towards protecting themselves from HIV and other STIs. So I think it's quite the opposite. Like, someone can actually be encouraged to say, oh, okay, so I can prevent this after all. So this is how it is done. So this plus this means safety, means I can never have to get sick or anything. And things will get better that way. I don't know if it makes sense.
Mm-hmm. All right. Thank you very much for your thoughts on that one. Now, who should consider using PrEP, and what factors might make someone a good candidate?
So PrEP really can be considered by any adult or adolescent who feel that they are at risk of contracting HIV. However, the person has to be above 35 kgs though. We have a thing of weight to it because of the side effects that can come with the medication, and for it to be proper adult dosage. And for it to be effective, the medication needs to be taken correctly. So the best candidate in this case would be someone who can actually stick to the treatment and take it as the doctor orders it. Because if someone is taking the treatment but they're taking it as they please, the effectiveness can be reduced.
All right, and thank you very much for your thoughts on the show for this evening. I do appreciate you. Now, we've talked about PrEP and who should consider taking PrEP. Let's talk about PEP, the post-exposure. In what situation should someone seek PEP, and how soon must it be administered after exposure?
For post-exposure prophylaxis, it is best to have the person take the medication, be started on it as soon as possible. As soon as possible, like the best time is within 24 hours. However, even within 72 hours, which is like 3 days, it will still be okay to start the post-exposure prophylaxis against HIV. The window will still be open. But after that, the effectiveness really will not be guaranteed. So that is the first thing. And then the person who can use it is someone who has been potentially in an infective situation, like the needle pricks or unprotected intercourse. And for even health workers, sometimes the nurses that work in delivery, they can have a blood splash into their eyes during a labor delivery. And that is an exposure. So as soon as possible, within 24 hours is best, but the window is still open until 3 days, 72 hours after the incident for you to take the medication.
Okay. So do people just get to walk up to a pharmacy and tell them they've been exposed, or how do they get access to PrEP and PEP, and what challenges are people likely to face when it comes to accessing PrEP and PEP?
So I think the first challenge is that people do not actually know about PrEP and PEP. So that is the first obstacle. That is the first challenge. However, for those that know, the cost of the medication can be an obstacle in certain countries, especially if people do not have health insurance and if their countries are not giving these medications for free. In pharmacies in my country, for example, we do have these medications available in certain pharmacies, but they are at a price. However, if you come to the public sector, we do have some clinics like the adult rape clinic that offers this medication for free, but it's mostly the post-exposure prophylaxis and not the pre-exposure prophylaxis. So now if you want to get the pre-exposure prophylaxis, it means the cost now is something that will be on you as a patient. And the other problem associated with this is stigma and discrimination. Mostly people are hesitant to go and seek out PrEP and PEP because they are afraid of what people will think about. Mostly it's the situation that will have predisposed them to being infected. For example, if someone has been in a relationship, a sexual relationship, that they think their partner was infected, them coming out about that can be difficult. Or if they're using drugs, them opening up to that may also be a challenge. And because of how society takes a look at some of these things. And the thought that they could be infected, they'll be thinking like, oh, if people think I'm positive, or if they know that I could be positive, how are they going to treat me? That is also another obstacle. So sometimes people just shy away because of stigma and discrimination. But yeah, in certain areas, it's really lack of access to healthcare, like in some remote areas, rural areas, lack of access, or even maybe at the clinics, sometimes there isn't someone who's well educated about the PrEP and PEP, and that is another obstacle to people actually getting help when it is actually available.
Thank you very, very much for your thoughts on the show this evening. 07000 917 917. That is the number to call to be a part of the conversation for tonight. If you would like to be a part of the conversation, please do well to call us. You can also send us a text and WhatsApp message on 0703 175 6537. Log into our website at www.thebfm917.com. Download your mobile app, the BFM 917. And if you are just joining us, you're listening to Chat4Health on Women Radio 91.7.
country people, Belle by Choice movements don't come again with our annual Belle by Choice campaign tagged 10,000 men give Belle by Choice, not by force challenge. We won't reach 10,000 men and young boys them in various communities with the right information on how they fit support women and girls' sexual and reproductive health, and they inform on modern contraception and family planning matter to end unwanted pregnancies. We won't make our papa, husbands, uncles, and brothers know say women and adolescent girls get right to their body and make them join hands to end rape, child marriage, sexual violence, and kasala wey they cause, such as girls' school dropouts and unsafe abortion where they threaten women's lives. If men they involved and supporting sexual and reproductive health and rights matter, it could empower women and adolescent girls to make informed choices about their health and could make them carry Belle by Choice. The 10,000 men give Belle by Choice could start 1st of September to 30th December 2024 in Nigeria. If you be man, woman, young girl or boy, join our movement to build a future where choices are made. For more information and inquiries about the campaign program, contact Martina Ebre on 0704 806 5486. Together, let us build a safe environment for women and adolescent girls. Remember, Belle now by choice, not by force. Belle by Choice movement is brought to you by Age and other young women groups them with support from the African Women Development Fund.
All right, 23 minutes past 7 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. If you are just joining us, you're listening to Chat4Health on Women Radio, WFM 91.7. And this is where we get to talk about everything you need to know concerning your sexual and reproductive health. You can call us on 07000 917 917 or 0800 1235 917. You can also send us a WhatsApp message on 0703 175 6537. Log into our website www.thebfm917.com. Download your mobile app, the BFM 917. Send in your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. In the meantime, on the show today, we're talking about the PrEP and PEP preventive tools everyone should know, particularly when it comes to HIV. And of course, my guest on the show today is Dr. Tariro Dorothy Togarepi, a compassionate and committed medical professional with a couple of years of experience in the healthcare field. Now, Dr. Dorothy, let's talk about this one for a moment, just before we get to call it a wrap on the show for today. So, how can we... Okay, so just before then, I'm going to ask you how often, I know you've said something about taking PEP for within the immediately one is exposed, and of course with the window frame being 72 hours. So I want to ask, how often does someone need to take PrEP, and what happens if somebody misses a dose? And yes, it's more like a 2-in-1 question. So while we're talking about PrEP, we're also taking a look at PEP. Can PEP be taken more than once? And are there risk factors associated with frequent use? Over to you.
Oh, thank you. So when it comes to taking PrEP, right, PrEP can be taken once. And then because PrEP is in very high doses,
okay.
So if you're going to repeat the medication, you increase the risk of getting side effects. And also, you also increase the risk of developing resistance. Resistance, we are saying the medication will no longer be working for you. So we really encourage people to just take PrEP once. And taking it, normally there are people that take PrEP like in one episode, right? They take it every day. And that is fine, like continuously every day. It's 1 pill a day. If someone misses a dose, they should just take the next dose the second they remember it. Like the moment you remember you've missed a dose, you take it. Mm-hmm. If you miss one dose, then it won't significantly reduce the effectiveness of the medication. However, there's also another way of taking PrEP, right? Which is like event-driven. We call it event-driven because someone can say, I'm going to work in this labor ward, for example, and I'll probably be at risk of getting exposed to this. So you take 2 tablets between 2 and 24 hours before the incident, and then you take 1 tablet after 24 hours, and then you take another tablet after 48 hours. So you take the tablets 3 times. The first time is like within 24 hours of whatever event you think could be infective, and then after 24 hours from the first dose, and after 48 hours from the first dose. But we're saying these pills work, but they are very high doses. So we don't really encourage you to repeat this, especially if it is an event-driven PrEP. But if it's something you're taking continuously because of a line of work, 1 pill a day, then it's all right. But stopping and starting is not encouraged as much as pre-exposure prophylaxis is concerned. And
post-exposure.
Now when we go to the post-exposure, yes. So for post-exposure prophylaxis, it's generally also not encouraged to take it more than once. However, for post-exposure, we said when you're taking it right, you have to take it within the 72-hour period from the exposure, and then it's for a duration of 28 days. And after these 28 days, you will have completed your course, 1 pill a day. And also, if you forget to take a pill, you should just take the same pill the next time you remember it. But if you now are forgetting various doses, then it can be a problem. But at least for pre-exposure, for people that know they probably have problems with taking various doses, they can opt for the injectable medication. We have injectables, like someone gets an injection once every 2 months. For those that are in a line of work or that are continuously exposed to a risk, so they can be continuously getting their injection once every 2 months.
All right, thank you very much. This is quite enlightening. Thank you very, very much. As a quality wrap on the show for today, what would be your parting words, Dr. Tariro?
So I would like to say thank you very much, firstly, for this opportunity. I believe prevention is better than cure. And the best way to prevent is to inform people. So may people just, take their health seriously and look for information, listen to these radio shows, be in support of everything that has to do with their health, because like you said in the beginning, your health is your wealth. So to everybody, I wish you good health and good night.
All right, thank you very, very much. There you have it on today's edition of Chat4Health, as brought to you by Age Network in partnership with PEPFAR Nigeria, Gilead Science, and AWDF. Many thanks to our guest, Dr. Tariro Dorothy Togarepi, for doing justice to that. Dr. Tariro is a compassionate and committed medical professional. And then we say thank you to her for enlightening us on what we need to know about HIV preventive tools like PrEP and PEP. I really do hope that you've been able to pick 1 or 2 things from the conversation for today. So let's do this again next week, Wednesday at 7 p.m. on Women Radio WFM 91.7. My name is Blessing Agweta. Once again, I say thank you to you for joining us on the show for today. Have for yourself a wonderful evening. In the meantime, I'll be back on radio at 8 p.m. Keep listening.